I'm Scott K. Roos. I'm a family medicine physician here out at Hawk Ridge Medical Associates with a BJCC medical group. Prior to medicine, I had worked on guidance, navigation, and flight control software for the space shuttle for NASA under the auspices of IBM and Lockheed Martin and Boeing and finally United Space Alliance. But after having done approximately 13 years in that career, I chose to switch careers. And basically it was because I wanted to broaden the opportunity. I guess I wanted to expand upon the opportunity to help individuals personally. Just helping people, getting to know patients and having particular patients. The main thing about family medicine, and particularly the outpatient world, is continuity of care. And that is the main strength of the outpatient world and also family medicine. And then you get to see patients again and again and again, and you get to see them over time, and you have the opportunity to see their spouses, you have the opportunity to see their children. I start basically after birth, so the pediatric population, all the way through the geriatric population. So that would be number one. I would say number two is just the intellectual challenge of medicine in general, and that you never know who's going to come walking through the door. The major strength with BJCC, I think, is that you have a number of various hospitals working together. You run the gamut in terms of specialists who are involved in BJCC. You certainly have a depth of care with BJCC. And then you have the ability to call upon the academic center when you need it. Caring for chronic medical conditions, because there are certain things like in diabetes, you want to keep track of your hemoglobin A1C, and high blood pressure, you want to make certain that you have a systolic and diastolic, which are the two measures of the blood pressure, under a certain level of control. And then in hyperlipidemia, you're looking to make certain, okay, what's your total cholesterol versus your HDL, which is your good cholesterol, and your LDL, which is your bad cholesterol. So being able to track those numbers, get people on the right medications in order to bring those numbers within certain levels. When I first joined BJCC, the auditors noticed that, and they said, there's a special recognition called NCQA, and we think you've got the numbers to go ahead and go for it. And so we compiled all that, and yeah, verily I did. And it stands for National Committee on Quality Assurance. And you can actually become NCQA in different chronic medical conditions. And it just so happens that one of the main ones that people pursue, because it's so prevalent and it's becoming more and more prevalent, is diabetes and then high blood pressure and high cholesterol.